My name is Donlin. I'm with Skin Perfection Aesthetics Laser and Wellness. And here we have with us Sarah today, who's a first-time Botox client. So I always am excited to get my first-time Botox clients because I always tell them, is number one, it's very addictive. And number two, it can really help aid in the aging process. People ask me all the time, how come my forehead is so smooth and wrinkle-free? And I always tell them it is because of Botox. So there's some common questions I get, especially from people who have had or having Botox done for the first time, is where can you use it? Some people want to think they can use it in their lower face, other areas like that. The most common areas to use it are from this area up. Very popular area is the forehead, which we're going to treat today with Sarah. That's also known as the frontalis muscle. We're also going to treat her glabellar region, which is also known as frown lines. The crow's feet are another popular area to treat. I have several clients I treat for a gummy smile. So if a client smiles and they have a very pronounced showing of the gums, we can insert Botox here and here, and that actually lowers their top lip down. The chin is another area I treat a lot of my older clients because it starts to get an orange peel look as you age, and that can smooth that right out. Also, we can give a very nice subtle brow lift with Botox, which Sarah does not need. She has a nice, beautiful arch to her brow already.
Thanks.
So Sarah, do you have any questions? We've already gone over the consent forms, which is very important. I've already prepped Sarah, so it's very important to get the areas super clean that you're injecting because you don't want to have the risk of an infection. So what questions do you have, Sarah, before we get started?
I think you've answered all my questions.
Okay.
I'm ready.
Okay. So I always like to use a little vibration tool. What this does is interrupts the pain receptors. We like to say we're pain-free here. So I will use this tool on you. If anytime you'd rather try it without, you can. Okay. I'm just going to show you on your arm what it feels like. Okay. It's just a mild vibration, but it's very effective with Botox. Another thing I like to do is use the smallest needles possible, and I always use a syringe for each area, and that's to keep the needle nice and sharp so it goes in easier and you feel it less. So we've already cleansed and prepped the area. I'm going to start with the very middle here.
Do I sit up or lean back?
I'm going to have you just lean back a little bit. Okay. Relax for me. Turn your head towards me. I want you to go ahead and push those brows together hard as you can. So this is actually a very big muscle. It actually innervates out here, so we're going to actually treat the whole muscle to remove that movement for Sarah. So go ahead and relax. You're going to feel the vibration first. You might want to close your eye. Here's the first poke. How are you doing?
That didn't feel bad at all.
I know, right?
Yeah.
Okay, here we
I think
go.
the vibrating really helps.
The next one. The vibrating does help. Next one. We're almost through this muscle. A couple little more pokes here. One more. Okay. She did very well. She's not even bleeding. Sometimes you get a little bump, or they call it a bee sting, but Sarah did not. Some clients just don't get that.
Making my eyes water.
So you doing okay? Are you ready to move on to the next area?
I promise I'm not crying, but it's making my eyes water.
A little closer.
Here's a little tissue for you. Okay, so.
It really does not, just like a little tiny poke.
Okay, so next we're going to do the forehead. Again, I want you to elevate that forehead for me. Okay, so this is the area we're going to treat for Sarah. Go ahead and relax. We're going to go through here, and then we're going to add a couple of units, a couple of different pokes up here. So since she's a first-time client, she's young, she actually has a smaller forehead. That helps me determine how many units to use. They will say exactly like 20 here, 20 here, but that's not always good for a client, especially someone younger like Sarah. She has a smaller forehead. If you over-inject an area, it's going to be too heavy. What I like to do is inject my clients, have them come back for a 2-week checkup. We see if there's any movement left or if we need to add some more units. That's easier to do to correct, and then I know how many units they take each time. Okay, Sarah, raise that up one more time for me. Okay, go ahead and relax. You're just going to feel little pokes here. Couple more, almost done. And one more. Okay.
How was that? Not bad at all. The vibrating tool is really
It's amazing.
cool, I think, yeah.
So, so now she's done. I just like to add a little arnica gel at the end, and this just helps negate any bruising. I don't see any signs of a bruise. I don't think Sarah's going to bruise. It is a little unusual to get a bruise, but basically we're done.
Wow.
So is there any swelling or any downtime?
This little bit of swelling will last maybe 15 to 20 minutes. You can see a little bit up here on her forehead. That's just the fluid that I injected in there. So that's going to go down super fast. And so you can apply makeup. I would wait at least an hour. Some other rules with Botox, you can't lay down for 4 hours. It can cause the product to spread. I'm very specific about where I want it to stay.
Okay.
Another thing, you can't massage the sites that were injected. I want you to avoid.
You can.
Yes. There's
this?
2 different schools of thought, but definitely move.
Okay. Don't be
For
afraid
24 hours, no active exercise that makes you sweat. And then the rest of the day, just don't elevate your body temperature.
Okay.
Since we injected your forehead too, you don't want to wear a hat or anything that's going to restrict your circulation.
Okay.
Okay, but other than that,
So should I be going like this to get it to?
there's 2 schools of thought. One is you should make those repeated movements, especially in the first hour. The second one is that you're going to move anyway without realizing it, and it's going to take effect just as nicely.
Okay.
So what I like to do with my first-time Botox clients is to have them come back in 2 weeks. We can recheck her, so we'll have her set a follow-up appointment, and then we'll see how it did.
All right.
Okay.
And
Thank
then
you.
during the month of August, we're running a special for $9 a unit for our Botox, and it's just through the month of August. But I do all the injections. I'm the nurse, and you always have someone that really takes care of you.
All right.
So come visit us at Skin Perfection.